All right, good afternoon. My name is Colin Diaz, President CEO of the Culver City Chamber, and we welcome all of you to today's HR Forum webinar, Employee Health and Safety in a Post-Pandemic Workplace. I think all of us can agree that the pandemic that we've all been enduring has been nothing short of challenging, and as our business sectors are starting to reopen, there's a lot of information out there from the CDC, from the California Department of Public Health, from the LA County Department of Public Health, and as well as many cities. And so to make a little bit more of heads or tails and some best practices, we are joined today by the fine folks from Insperity. First of all, I'd like to thank Insperity for partnering and sponsoring today's event. You'll hear from Maria Jacobo, who in addition to being a part of Insperity, has been a longtime Culver City resident and contributes in the community, as well as Peter Zaretskiy. So without further ado, just want to restate one item. If you have questions during their presentations, please select the Q&A function, and that'll allow you to type in your question there, which we will then get answered at the end of this presentation. But without further ado, I would like to introduce our first presenter, Maria Jacobo. She has been with Insperity, or actually in the business, for 20 plus years. But besides her work with Insperity, she is a Culver City resident, parent of kids that have gone through Culver City Unified School District. She was an ambassador of the Culver City Chamber and currently sits on the Culver City Chamber board. So I am very pleased to be joined by Maria today. I'm going to let her share a little bit more about Insperity, and then she'll introduce Peter. So with that, Maria, welcome.
Thank you so much, Colin, and thank you so much to the Culver City Chamber of Commerce, and thank you to everyone who is joining us today. Welcome to our Insperity webinar, Employee Health and Safety in a Post-Pandemic Workplace. We know that there is so much information going around from so many different sources, and that can be overwhelming. So our goal today, in today's session, is to answer your questions in real time. Please keep in mind with the information, with this information being provided on today's webinar, that it is in the form of best practices. We encourage you to speak with your own HR or legal department if you're not currently partnered with Insperity. My name again is Maria Jacobo, and I'm a business performance advisor with Insperity. I'd like to share a little bit about Insperity. Insperity has been around for more than 34 years. Our mission is to help businesses succeed so that communities prosper. We're a publicly traded company and serve more than 100,000 businesses and some of the best companies nationwide. Next slide. Insperity provides an array of human resources and business solutions designed to help improve business performance. We provide full-service outsourced HR, Fortune 100 benefits for your employees, and cutting-edge HR technology. Insperity supports your business so that you can focus on revenue generation, in protecting your net profits, and in keeping expenses down. Our proven approach helps small to medium-sized businesses manage costs and minimize risk, and we help businesses bring out the best in their people by maximizing their team's performance and productivity. And, next slide, please. And as part of our clients, the next slide. Thank you. And as part of our clients' local dedicated HR team, our clients receive a safety consultant. This individual has proven to be very important, particularly during COVID-19, in helping to create a safe and healthy workplace environment. Next slide. Thank you. Now, I'd like to introduce you to our presenter, Peter Zaretskiy. Peter is a safety services manager with Insperity. He has over 14 years of experience in the safety field, working in a variety of industries, from manufacturing to healthcare to higher education and the public sector. In Peter's role with Insperity, he regularly consults with businesses on issues related to workplace safety, loss control, and injury prevention. Without any further ado, here's Peter Zaretskiy.
Thank you very much, Maria, and good afternoon, everyone. I am glad to take this opportunity to talk to you today as we are currently in indeed trying times. As you may notice on the news, they have announced that the cases in California continue to rise, in Los Angeles County in particular. And as our businesses begin to reopen, what is our main consideration when it comes to employee safety in the workplace? Our main goal right now is to meet due diligence obligations for establishing best safe practices, and while we're doing that, obtain buy-in for our employees. Now, how will that look? Our goal is to make employees understand what safety measures are being taken and why. And once they do realize the importance of a mutual buy-in, of a cumulative approach to making sure that everyone follows the rules and we have the ability to prevent the spread in the workplace, then we can take steps to reduce instances of prolonged person-to-person contact. Now, I will come back to this term during my presentation, but whenever I mention prolonged person-to-person contact, I will refer to instances where you have two or more individuals who spend 15 minutes or longer at a distance of closer than 6 feet. Next slide, please. So, if you follow the news, you may notice that we have been in phase 2 for a little while now. And what does that mean? It means that businesses that are considered low risk can begin to reopen, as well as businesses that are considered to be medium risk. How do we determine what risk group you belong to? The best question to ask yourself in this instance is, do you provide services to patients who are positive for COVID-19? So those would be your healthcare providers. Those are what we consider to be high risk environments, similar to any convalescent homes, similar to law enforcement, security, caring for individuals in enclosed proximity where the risk of infection spreading is fairly high. If you are working in a more clerical environment, if you are in fact working in a retail environment where you may come in contact with general public, you are considered low to medium risk. And at this point, you have a little bit of a leeway when it comes to reopening. However, I wish to remind everyone, we are still at a time of great deal of uncertainty going on. We don't know how the cases will continue to rise, if they will continue to rise, if they will continue to plateau, or if they finally begin to drop. I ask everyone to exercise caution as we go along. And this is truly one of those instances where you have to take it literally one day at a time. Next slide, please. Now, since we are in California, we are bound by what's known as Cal-OSHA. OSHA, which stands for Occupational Safety and Health Administration, has a California division. And for all businesses in California, and for that matter in the rest of the United States, we are bound by what's known as the General Duty Clause. In California, it has a special name. That name is Injury and Illness Prevention Program. In a nutshell, the General Duty Clause requires that employers establish an environment that's free of risks or causes for injury and or death. Furthermore, employers have a liability to address workplace hazards even if there is no actual OSHA standard listing the safeguards for that particular danger. So just because you have a business, you have this obligation. And in California, there has been a recent development where you, as an employer who has an injury and illness prevention program, as we all should, you need to add a specialized appendix, which is a pandemic response plan aimed at COVID-19, but honestly, in the future will be perceived as a response plan for similar pandemics as they begin to frequent. So what will this include? It will include guidelines for business continuity, response to positive cases in the workplace, staff communication. I cannot stress this bullet point enough. Staff communication is training, and I will address that in a couple of slides, but you need to be able to train your staff on recognizing where the risks lie and how to mitigate them, as well as what will be your return to work methodology and the recordability with respect to OSHA. Now, for some of you, recordability may not say much. Let me elaborate. If you are belonging to a certain group of businesses that are defined by OSHA as increased hazard, just by definition, you are required to keep what's known as the infamous OSHA 300 log. Some of you may know what this is. For those of you who maintain it, any case of workplace COVID-19 diagnosis is what's considered to be an OSHA recordable injury. It needs to be entered on that log. There's also a very special caveat I want to address with you. A couple of weeks ago, our governor has announced that with respect to workers' comp, in California, there is what's known as a rebuttable presumption. What does that mean? Let's say you have an establishment that has been opened during the time of pandemic. And let's say you have an employee who may or may not have been coming into the workplace. If that employee comes to you and tells you that they have in fact been tested positive for COVID, it is a workplace-related injury and it requires you to file a workers' comp claim. And then the burden is on your broker or on your workers' comp claim provider to perform the investigation and determine if that injury is in fact workplace-related and therefore is covered by the workers' comp compensation. Now, also, as we keep going, I want to share something that relates to the actual controls. Next slide, please. So this is something I have to address with my client just in my regular life as a safety professional. But certainly in the event of COVID-19, same idea applies. For all of you, regardless what business you operate, regardless of what field of industry you're in, when it comes to controlling hazards in the workplace, you need to abide by what's called the hierarchy of controls pyramid. So you will see at the very bottom, our very basic requirement is personal protective equipment. There is no escaping that. At the very least, we have to make sure we have personal protective equipment readily available to us and it actually fits our needs. However, we don't just stop at personal protective equipment. Our goal is to continue up the hierarchy of controls pyramid right up until we reach the very high end of it, which is the elimination of the hazard whatsoever. You may ask yourself, in the environment of COVID-19, what is the elimination of the hazard? This is where you don't have employees coming in contact with a source of infection at all. They don't socialize with one another. They are telecommuting. They are staying at home in self-isolation, which is something we've been finding ourselves since mid-March. Obviously, it may not always work for some of your establishments, and that's understandable. However, you still need to do the best you can with administrative controls, which are social distancing protocols, cleaning schedules, engineering controls, which would be physical barriers. Some businesses are also considering air filtration systems. So all those are necessary controls you need to consider and then proceed from there. Next slide, please. Now, what I'm going to do, I'm going to touch upon some basic best practices, and as you will review these, you will notice that some of these will apply to more than others, but I feel it will be beneficial for everyone just to review one at a time and see how we can put these to good use. Also, please bear in mind that these safety measures are projected to be implemented at the very least the first and second week after returning to work. What that return to work will be like, that will depend on you. You may opt to have a cold open, meaning you open the premises, you may have a skeleton crew that barely does anything other than keep the lights on, or you may start to provide services. That is your decision, and that is your prerogative. So I will spend a little bit of time talking about facility disinfection and sanitizing. That will be in the little future. Same will go for personal protective equipment. Right now, I want to focus on making sure that you have an option for your staff to ensure a flexible work site. What does that mean? For many of you, your employees have been working remotely from their homes. As you start to reopen, I want you to maintain that option as an open option, meaning, let's say you have employees who are working on more of a clerical side. To mind comes somebody who may work in accounting, customer service, project manager. If they can continue working from home and remain just as efficient as they were whenever they were actually on site, I ask you, for the sake of reducing the number of people in the workplace, for the sake of reducing crowding, keep people at home for as long as you can. Also, let's say you have an establishment that doesn't just serve employees, but you actually have general public that comes onto your premises. How do you determine what would be the best occupancy? So we all heard about the 6-foot clearance, the 6-foot distance between one another. Great. Let's apply that distance in every direction, in front of us, behind us, and to our sides. We find ourselves in the middle of the square that's 12 feet by 12 feet. You multiply that, you get 144 feet. Round that up, you get 150 square feet of usable space. And if you take a look at your premises and you find out what the floor plan is, you can actually already approximate what would be the good number of individuals to start bringing in at the very beginning. At the same time, if you can limit the amount of visitors that come into your premises, do so. The goal is to make sure that we bring in few people at a time, make sure they are getting comfortable with these new protections in place, and again, getting people familiar and comfortable with the concept of keeping away from each other, reducing those instances of prolonged contact, just like I mentioned before. Furthermore, you are asked to make sure that headcount is limited in areas such as locker rooms, bathrooms, conference rooms. Some of you may be eager to get back into that conference room and have the meetings just like you did before the pandemic struck. I ask you, even if you have individuals still in the same office, encourage them to have conference calls like this one, have Zoom meetings, have Skype meetings, whatever technology you may have. But the goal is reduce the instance of people interacting. Make sure it's as limited as possible. So let's talk a little bit about facility sanitizing. Next slide, please. Some of you may ask yourselves, we are about to reopen our premises. What do we need to do? Do we need to scrub the building from top to bottom? What is our priority? This in front of you right now is a chart, a flow chart that was put together by CDC. And I find it to be a very good tool. And let's briefly touch upon some of these items. So first of all, you need to ask yourself, have I as an employer had any cases of COVID-19 positive cases in the workplace? If the answer is yes, you need to make sure that the areas where those infected individuals have been isolated and you indeed disinfected with EPA-approved disinfectants, bleach. There are numerous methods of doing so. Something I've seen my clients do is actually outsource it to third-party vendors who will come in, who are equipped, who are trained, and they will indeed scrub the area top to bottom. Now, let's say you haven't had any COVID positive cases in the workplace. Wonderful. In that case, you need to ask yourself, have we actually been closed all this time? Because you cannot just open your doors and let people walk in. You need to perform a good, deep, routine cleaning. What will be your emphasis? Your emphasis will be any commonly touched surfaces. What can those be? Think about your doorknob. Think about your elevator button that you press in order to get up to your floor, or the stair rail that you touch when you walk up and down the stairs. Consider the copier room in your office. It has buttons. Consider your break room. It may have something as simple as a coffee machine, yet you may have people lining up in order to get their morning cup of joe. They keep pressing that very same button. Same goes for counter space that is communally used. Tabletops. You need to make sure that those areas are routinely cleaned several times a day. How many? It depends on you. The good practice would be 2 to 3 times. But the goal is actually to also train your staff to start cleaning up after themselves. So then they don't just focus on the commonly used areas, but also their personal equipment, their personal computer mice, their personal keyboards, their personal tabletops. The goal is to keep the area as clean as possible, and then we can actually include something like scrubbing your floors, making sure people don't track the infection on the soles of their shoes and then have it percolate in the area. So you avoid the instance of somebody, say, dropping a sheet of paper onto the floor, picking it up, touching it with their bare hand, forgetting to wash their hands. Now they have the risk of coming in contact with this illness. Next slide, please. I want to also talk to you a little bit about the personal protective equipment. Many of you have heard about N95 respirators. Well, what are they? They are an OSHA certified device that is able to filter air particles by at least 95% when properly fitted to the user. So you can't just put the N95 respirator on and expect it to be effective. In fact, these respirators are currently being reserved for healthcare industry. If you are looking for one online, if you are trying to get it for your employees, I ask you to actually not do that unless you're a healthcare provider. If you are any other business other than a healthcare provider, a homemade mask or something that we call a face covering is just as good. Same goes for surgical masks. While they're a little easier to find than N95 respirators, I still ask you to reserve those for healthcare providers because, again, they need as much protection as they can get. Meanwhile, the rest of us, even if we do interact with general public, we can still use a regular face covering. Now, there has also been a lot of confusion that I want to clear up about cloth masks, paper masks. Some people have actually been using scarves, bandanas, what have you. What is their purpose? What do they help you with? When we look at the N95 respirator or even a surgical mask, they filter the air when you inhale. So they're protecting you against the environment. They're protecting you against other people. The face covering actually works in reverse. It helps reduce breathed out particles when exhaling. Quite frankly, it protects everyone else from you. So this is why when we ask people to put on the face covering, we make sure that it's also paired with social distancing and good personal hygiene, because there is no way it can reduce the amount of exhaled viral particles, if somebody is in fact infected, by 100%. But it reduces it. And our goal is to limit the spread to the best of our ability. Now, with respect to facial coverings in Los Angeles County, next slide, please. You as employers are required to make sure that your employees have a face covering when they are in the workplace, and they are expected to interact either with each other or with members of general public. If you have an employee who does not have a face covering, you have the responsibility as the employer to provide them with one. Also, you are asked as a business establishment to do the best you can when it comes to physical distancing, to make sure that you can put some kind of a barrier, if at all that's possible. If not, again, you're asked to reconsider whether or not you even want to provide a service to a general public member, or if you want to have a fewer of your people on site so that they are spending time in relative isolation and good distancing from one another. Also, there has been some confusion whether or not you can serve members of general public who enter premises without a facial covering on. Because of the recent increase in COVID positive cases, currently the orders are, if in Los Angeles County, if you are in public setting, you need to have a face covering on. Furthermore, and I would imagine this is already a case for most businesses, but let's make sure. If you have a brick and mortar establishment, you need to have a solid bathroom facility where people have readily available access to, where they can wash their hands repeatedly over the course of the day. What about disinfectants? So in the very beginning of this pandemic, we have had a shortage when it came to hand disinfectant. And people were very concerned. Are they at bigger risk because they don't have the sanitizers and disinfectants readily available to them? To put things in perspective, a comprehensive hand washing that takes place over 20 seconds with warm water and soap is just as good as putting hand sanitizer on your hands. You as employers are still encouraged to make sure that people have access to it. But at the very least, please make sure that you have a bathroom facility that is readily open. Now, here's yet another caveat that I ask you to consider. Next slide, please. When we ask people to monitor for symptoms, some of you may opt in to take temperatures of everyone who enters the premises. And it's projected that this may have to continue at least up to a month. but as cases continue to rise, that may be extended even further out. Temperature taking is great. You need to consider what kind of a thermometer you need to use, whether it's something that you can use over distance. The one I actually have on this slide is what's known as an IR thermometer, and it allows you to take a person's temperature from several feet away, already encouraging social distancing, as opposed to a model that requires you to physically press it against somebody's forehead. But temperature taking does not capture people who are asymptomatic. They are not having a fever. In fact, they don't have any symptoms. So if you rely strictly on temperature taking, you run the risk of have those individuals just walk past the control station and now they're in the workplace. And they possibly are shedding viruses and they're infecting others. So in addition to temperature taking, should you choose to pursue that route, I highly encourage implementing what are known as health survey questionnaires. Those are basic questionnaires that ask people, and those could be your employees, those could be your visitors, has that individual been in contact with somebody who has tested positive for COVID-19 in the last 14 days at the very least? Has that individual has had any symptoms recently? Has that individual been tested positive themselves and at least 14 days have passed? Once you have that verbal confirmation from an individual, you can make a far better judgment call. And as I continue to say, please make sure your employees understand on what is a COVID-19 symptom. Some of you may consider fever and coughing to be the biggest indicators, and that is indeed the case. We have also seen sore throat, severe headaches, lost the sense of smell and taste as also very unique symptoms that are attributed to COVID-19. Your people need to know what they're monitoring for so that they are being efficient. And furthermore, you need to remind them that even though you have a little station by your entrance where you monitor everybody who enters in, they are still required to observe good social distancing, good personal hygiene practices, and wear their PPE. Next slide, please. When it comes to business travel, so the current guidance from CDC asks everyone to avoid all non-essential business travel. We also agree with this and we encourage it. Absolutely, positively avoid public transportation, particularly planes, trains, where you are stuck in a very enclosed space with a group of individuals and you are just running a higher risk of coming in contact with somebody who may be inadvertently infected. People who are returning from overseas will be asked to self-quarantine for at least 14 days. We have actually seen the same done recently with states like Hawaii, where it's actually been something that has been lifted recently, but we saw individuals who are arriving to the state of Hawaii, they were put into quarantine. The goal was to reduce the risk of somebody bringing the virus from overseas. Also, with respect to domestic travel, there are no actual restrictions being posted by CDC as of yet. However, we all follow the news. We see where cases are currently rising. The first state that comes to mind is Florida. So let's say you want to travel to Florida because you have a client there or you have another establishment that's related to your business. Ask yourself these questions. Are the cases increasing where you or your staff are going? For some states, they actually may ask you to provide a written authorization because if you don't have one, they may not even let you enter the state. Will you be able to maintain good social distancing? And what are your means of travel? However, just as we are performing a webinar right now, just as I have previously mentioned, that whenever you try to have a conference call or a conference conversation with your staff, make sure people are relying much more often on phones and even video calls. That is our priority right now. Our priority is reduce personal contact. For how long do we have to reduce it? At least until we see a decrease in cases. At that point, we know that either we are starting to build herd immunity or the spread is not as prevalent, it's not as rapid, and we have the ability to at least lessen our restrictions. However, I ask you not to lose your vigilance. We will be in this environment, we will be under these precautions for quite some time. And right now, at the very least, train your staff on recognizing the symptoms and making sure that they remember to avoid all prolonged contact. Next slide, please. Now, I want to really briefly touch upon what my team and myself personally do with Insperity. We are one of the services that is available to Insperity clients. There's about 20 some of us. We're spread throughout the United States. And as consultants, we are certified and trained individuals who provide a variety of services. Some of it is related to training, accident investigation, technical consulting, custom solutions, whatever they may be. Most likely would be training or inspecting the premises, inspecting projects. And unfortunately, right now, or fortunately, for the last 3 months, all we have done is COVID. All of our clients have had the same question. There is COVID-19 going on. We have employees who are actually testing positive. What do we do? Do we need to draft a plan? Yes, you do. Do we need to clean our premises? Yes, you do. Do we need to send people home? It depends. So at this point, I would actually like to open the floor for questions, but I want to remind folks that even though these are pressing times, these are also very dynamic times. And at least in my memory, this is the first instance of something like this happening. So we learn as we go along, and our goal is to stick to best practices and do our due diligence.
Thank you very much. So got a few questions that have populated in, and the first one is from someone that says, I manage a commercial office building that has 7 floors. We maintain the HVAC with high quality filters. Tenants think that HVAC can spread the virus throughout the building. What are the facts regarding HVAC and the spread of COVID, assuming that there are people with COVID in the building during office hours?
Wonderful question. So interestingly enough, whenever we started talking about HVAC when reopening facilities, we were more worried about the HVAC system staying inoperative for quite some time. At this point, we were strongly advising people to make sure the water towers are cleaned, make sure there is no stagnant water that can spread what's known as the Legionnaire's disease. With respect to the airflow, first of all, the reduced temperature of the airflow reduces the spread of the virus. The filters, if you're using HEPA filters, also help reduce the number of the viral particles. And something that is actually worth looking into, there are actually some UV light systems that can be attached to your vents. And what they do is essentially they zap the air as it passes through. So look into the options. But at the very least, as long as you continuously run the AC system, as long as you recirculate the air from the outside in so you don't have the situation of a stagnant air continuously recirculating, and you maintain it at a low temperature, you are already ahead of the game.
Thank you very much. So the next question has to do with ADA. So how does the Americans with Disability Act interact with the mask requirements? I've seen some customers complain that they have a disability that prevents them from wearing a mask, and then claiming the business cannot deny them entry.
Absolutely. And ADA has actually been in works with OSHA and CDC because, quite frankly, individuals who fall under ADA protections may themselves be more prone to catching COVID-19. So what you as a business can do in order to address the ADA compliance and help prevent the spread. Let's say you have an individual who cannot enter the premises because they don't have a facial covering on. Can one of your employees take their order remotely and then bring the goods or whatever it is that the service there for outside? Let's say you have a law office and you have a customer who wants to come in and have a conference. However, they cannot wear the mask or a facial covering rather because of a certain health condition, and that is completely legitimate. I ask people to give a good benefit of a doubt to one another. Surely there have been instances of people who willingly refuse to wear a face covering, but let's, for the sake of the argument, say the person has a respiratory distress or a situation, or they have asthma, and wearing a restrictive device, such as a face mask, can be detrimental to them. Again, look at the options such as telecommuting. Look at the options of distancing yourself from them as much as possible. Now, I have actually had a client who provides services with individuals with mental disabilities. And it's actually in-person service. And I was asked the question, well, if our employees have to wear face coverings and our clients need to wear face coverings, there will be a point when people will start to feel anxious. They will start to feel stress. And how do we address that? It is completely understandable. And I personally suggested that if you, your employee or your customer feel like the stress is becoming overwhelming, perform what's called a mask break. Step outside, step into the area that's isolated from everybody else, lift the mask, take a couple of deep breaths, at least regain your composure. Then the face covering comes back on and you can continue doing whatever you were doing. Let's say employee is sitting in an office all by themselves and their door is closed, there's nobody around, and you know in their heart of hearts, they will not be in contact with anyone for extended period of time. The mask can come off. However, the moment they know either their coworker is about to approach them, a customer is about to approach them, the face covering comes back on. Sounds fair?
Yeah. Thank you. So clarification question, because we had a few people that wrote us initially when we were marketing the event, and post-pandemic is somewhat optimistic, since even you just alluded to the fact that we're going to be in some phase or in some impactment, if you will, from the pandemic for the foreseeable future. So two questions that tie to it. The first one is with regards to, you were mentioning workers' comp case, and if an employee contracts COVID, that even if they were not physically in your office at the time, or that there's still a certain responsibility. If you're a company that has been working remotely for, let's say, the majority of the pandemic, is there a set point, if you've been quarantined, so to speak, for a month, does that clear you from any type of liability, or is it still matter if the employee is working for you remotely and has potentially contracted COVID? Is that a responsibility that a company would still have?
So the best practice would be, again, ask yourself, if that employee has been 100% at home, they have not been in contact with any of their coworkers, they have not entered the facility, they were 100% remote. You can argue that if they have contracted COVID-19, it was done through communal spread. I would still suggest you reach out to your workers' comp carrier and at least confirm with them. If they say, you know what, just to be completely 100%, 200% safe, let's make a report, but it could be a report-only situation. And report-only situations are claims that do not have a dollar amount attached to them. They exist strictly for reporting purposes, and depending on your carrier, may not actually count towards your count. If you have a possibility that the employee has entered the premises even once over this entire course of time, you simply cannot make that judgment call. Your best course of action is to call it in. And I understand this is burdensome. And unfortunately right now, California is the only state that have gone this route. Yep. Everywhere else, the employee has to prove that they in fact contracted it in the workplace. California has decided to take much more drastic measures, and this is where we are right now.
Well, California has not always been on the side of the employer, so this shouldn't surprise anybody. So next question, what limits do you have when communicating to employees about positive cases discovered within the employee base? So I'm assuming this is regards to HIPAA and what you can or can't disclose.
Absolutely. You cannot disclose the employee's name, whoever was infected. Now, let's say you have an office, open space environment, and one of the co-workers has tested positive. Everyone in that area needs to be told that somebody in this office who is sitting in this general area has in fact had COVID-19, and this individual may have been on premises during these days, particularly if you have a staggered work schedule. Now, you may say, well, this is how the employees will figure out that it was, I'm just going to use myself as an example. This was Peter. Peter's the one who brought it in. This is a communication between employees. This is a communication between staff. You, as an employer, did not disclose that name. Your responsibility was to advise staff on what the next steps will be. The next steps will be asking people if they know that they were in contact to self-isolate, get tested if they manage, but at the same time, also make sure that the area is cleaned up.
Thank you. So this next question is one that we get a lot. I have a little bit of an answer on it, but I'm curious as to what your insight is. So what is the liability for businesses that experience an outbreak? If a customer and employee is being irresponsible on their personal time and becomes infected, then comes into your place of business and it spreads to a customer employee, do I have liability as a business owner, or am I protected as long as I follow government issued guidelines for my business?
So the answer is twofold. Let's say you have Peter, who is a very irresponsible person. I apologize to anyone else who is named Peter, I mean myself. And let's say I traveled to a pool party and I was in close proximity with a number of individuals, and I come down with COVID-19. I may feel sick, but I don't want to lose my work hours, so I report into the workplace. If you have a medical screening at the door and you're taking temperature, and let's say I have a fever and you catch me right then and there, you prevent me from entering the premises in the first place. Let's say I don't have a fever and I manage to enter on site. You have me wear my personal face covering. You have me wash my hands. You have me avoid other coworkers. So what have I been describing? I have been describing best practices for social distancing and good personal hygiene, which what all businesses are required to abide by. You have established those already. You maintain those. You already follow the guidelines that CDC, that OSHA have put forth. We obviously cannot control all of our individuals, but by at very least implementing these safeguards, you're reducing the risk of the spread. Because the scenario that was put forth, if the employees are responsible in their personal time, they become infected, they come onto the work site and they start spreading it around, that leads me to believe that you may not have been following the rules, that you not have been putting in these protections. You have people congregating for extended period of time. You have people not following good social distancing. They're not washing their hands. You're not sanitizing the area. You're not wiping down commonly touched surfaces. With respect to liability, currently OSHA is focusing on healthcare environment because unfortunately we have seen a lot of deaths in the workplace related to healthcare environments with doctors, nurses, EMTs, individuals who deal a lot with infected individuals, and because of the lack of controls, they themselves have contracted this disease with a lethal outcome. However, even though right now we're in a bit of a leeway while the employers are given a chance to catch up with these requirements, sooner or later the question will be posed, you as an employer, what have you done and what can you prove that you have done that limits the spread of disease in the workplace?
Thank you. So with regard, you were mentioning, this probably falls in line with the responsible employees. Excuse me, well, actually two parts. One, to tag on to what you just said a minute ago, from a liability standpoint, there is nothing in the state or federal right now that extends protections as it relates to liability. So you can still do everything CDC or county is asking you to do from a health standpoint. And it would definitely reduce the risk, which I agree with you on, but it does not preclude you, particularly in California, from having liability. So that's something just to share with you guys that are tuning in. The Chamber has been advocating for almost the entire pandemic, and we are with other entities. There's about 130 chambers throughout the U.S. that are pushing for that whether it's, you know, benchmark of 10 or 15 things that a business needs to do, and as long as they do those, it provides some coverage. But right now, that does not exist, so it's something to note. So the next question is in regards to, we'll just say to another Peter. I have an employee who is traveling from California to Texas for a personal trip. Upon their return, can we ask them to self-isolate for 14 days before returning to work?
Absolutely, you can. Now, the employee has to prove that they, in fact, have not been in contact with anyone who has tested positive, who has not been showing symptoms. So if you feel comfortable asking that person to stay home, you may want to consider giving them medical leave or just determining what the best course of action is, or asking them to get tested before they come back simply because they have chosen to travel. You didn't ask them to travel. They have chosen to travel, and you may actually ask them to work remotely, at least until a week passes, 2 weeks if you are definitely able to accommodate them this way. And if no symptoms occur, and in fact, if they manage to test negative, they're welcome back into the workplace. But again, I urge you to appeal to the good sensibility of your employees. Ask them that unless it's absolutely positively necessary, please avoid from doing so. We are in troubling times right now. We ask you to think of yourselves, think of those around you.
Okay. Are there any guidelines for cleaning or sanitizing portable digital equipment such as laptops, tablets, and cell phones?
So I would suggest that if you have a disinfectant wipe that is not very wet, that would be something that you may at least wipe down the buttons. With respect to touch screens, so let's say you have a business establishment that either has an ATM on site, or you have one of those digital check-in tablets. I've seen those pop up fairly recently before the COVID-19 struck. So when it comes to those, you can choose to wipe down in between people, providing them with a stylus that can be wiped down. And by the way, most styluses actually do work with ATM touchscreens, as well as the iPad touchscreens and similar devices. The goal is to be in control of what is touching what and how can you wipe it down afterwards. But I would say your general over-the-counter disinfectant wipe would do the trick.
Thank you. Next question: for ventilation in a patient exam room in an outpatient medical office building, what do you recommend if the air circulation from the HVAC system is not very good?
So let's say you have an older clinic, older building that doesn't have a good HVAC system. Prevent people who are testing positive from entering the premises. You can actually set up a testing station before patients even enter the premises. So the greater your confidence that there are no COVID positive patients on site, the less you need to worry about what you have in terms of limitations when it comes to your HVAC. Make sure the air circulation is ample. How do you do that? Keep the HVAC running. Make sure the filters are changed regularly. Even if the air exchangers are not sufficient, open your windows, allow fresh air in. But again, my best advice to you, if you are an outpatient clinic, you have the ability to ask your patients if you are suspecting that you are COVID positive, if you may have those flu-like symptoms. Don't come into our office. Provide them with information where they can go get tested. Temperature check them before they enter. But as long as you know that people who are already inside are more likely than not are symptom-free and don't have don't have COVID-19, then your confidence rises dramatically.
Okay, so what sources are now selling approved PPE?
I wish I knew, because I would be buying them myself.
I can tell you, I mean, there are a lot out there. There's a member that we have of the chamber, but not trading. If you go on to our website and also to our social media and to our website, they recently did a chamber chat with us, and they own the other side of their business is a logistics company. So they've been able to secure large numbers, and their whole vantage point is that they're able to provide smaller numbers to companies, because obviously if we're not needing tens of thousands, it makes it costly. But I'll let you go ahead and answer the rest of that, Peter.
I would suggest to be mindful of who your vendor is. Unfortunately, we have seen instances where a lot of providers are promising quantities of equipment and then they either underdeliver, or we have seen instances where unapproved devices are being marketed as something that is actually NIOSH approved or CDC approved.
Right.
When it comes to disinfectants, when it comes to gloves, when it comes to masks, and by the way, I'll take this opportunity to talk a little bit about gloves, because I have had clients who ask me, are gloves necessary? The answer is an emphatic no. If you're providing personal protective equipment to your staff, this is what you need to focus on. Facial coverings for everything that is not healthcare related. If you are a healthcare related business, you want to make sure you use surgical masks. If you're not working with COVID positive patients, if you are working with COVID-19 positive patients, you may need to go with N95 respirators. 3M usually is a great provider. They have been working overtime trying to replenish their stocks. You may want to consider use of face shields. Those could be your clear face shields that you can combine together with the mask, particularly if you are working with people and you have to work in close proximity. I have a client who provides therapy to children, and unfortunately, they need to be working very close with one another in order to be effective. So what we have recommended they do is wear a facial covering, but also combine it with a face shield.
Thank you. So for those who work similar down the office line, those who work in an office environment, does the face covering policy require employees to wear a mask 100% of the time, or only when they are in public areas and cannot maintain 6 feet plus of distancing?
So I already mentioned this, but I will gladly repeat it because, in fact, this is something I myself has come in contact. And in my previous lives, I had to wear a respirator, I had to wear a face mask, and after hours upon hours, it does not get very comfortable. So this is the compromise that we can reach. If you have an employee who is all by themselves, they're in their office, they are not coming in contact with anyone, the mask can come off. However, the very moment they know that they will be interacting with a coworker or they will be providing a service to a general public member, in person of course, the facial covering comes back on.
Thank you. So a few more questions regarding bathroom facilities. COVID-19 can be shed from GI tract during defecation. When the toilet is flushed, a viral cloud can result, especially if the lid is not put down. What is a proper way to disinfect a bathroom, specifically since there's no way to monitor whether the toilet lid is being put down?
So there have been several cases of the spread through a GI tract. That is true. Thankfully, it's not one of the main ways it's being spread, but those anecdotal situations are still something we need to be mindful of. I highly encourage you, if you have the ability to do so, install remote flushers. Those will be the laser-triggered flushers that when the person rises or steps away from the toilet, it flushes, but the person has already taken a few steps back and they're not coming in contact with the viral cloud. Ask people to use seat coverings and the paper seat covers. Again, those can be easily disposed and they restrict the virus from rising into the air. And again, I cannot stress this enough, encourage people to wash their hands after they use the restroom. We learned it back when we were in kindergarten. Now is a good time to remember. You do not exit the restroom until you wash your hands. 20 seconds, warm water with soap. That's it.
Okay, so if an employee is diagnosed with COVID, beyond telling the other employees that someone in the workplace has been affected, do we have to require the other employees get tested and or shut down the business until we get results back? And then also, if they need to be tested, are we as the owners required to pay for the test, or does the employee pay for it themselves?
So this is a great question and also something that I have been addressing. Right now, employers cannot require employees to get tested. The reason being, there may be a shortage of tests. So we cannot require somebody to test for something that they may not be able to get access to. If you do have an employee who tested positive, you can determine who was in proximity to that person. Again, I will stress this again, proximity. Let's say you have somebody who's working in the mailroom, and that individual comes in contact with, let's say, for the argument's sake, with 3 other people. Those 3 other people are being asked to self-isolate for 14 days until they manage to either get their hands on the test and test negative, but that's optional. They can stay in self-isolation for those 14 days, after which they can come back and they're deemed safe. Do you have to shut down the whole facility? Not necessarily. At the very beginning of the presentation, I mentioned that if you're disinfecting after a positive COVID-19 case, you want to make sure that you're isolating the area where the infected person spent the most of their time. And you can have that little piece of the facility disinfected, it's isolated, it's marked off, the rest of you can still work. You don't have to shut down the entire building.
That makes sense. So upon reopening, and this is kind of the million-dollar question here, if an employee refuses to come to work and wants to work from home, what shall and what can an employer do?
Great question. So let's say you have an employee who is able to perform their work remotely and they were just as effective as they were when they were back in the office. Like I said, I highly, highly, highly ask you to consider that as a viable option in keeping your business running. When we reopen, when we start coming back, we already have to bring in as few people initially as we can. Right. If Peter can still work from home and you can empirically confirm that Peter is being just as effective, let them stay home, at least until they feel comfortable coming back into the workplace. But if they're already being effective, if they have all the necessary tools and equipment, then why wouldn't you want them to stay at home? For now, on the flip side of that, let's say you have an employee, Peter, who has to perform their work on site. Their task is something that has to be done manually, and simply you cannot have them work remotely. Order picker or shipping and handling. And Peter comes to you and says, you know what? I am not comfortable. I am scared for my life. I don't want to come into the workplace. Under OSHA, employees only can refuse work when there is a clear and present danger of an immediate hazard to their health or life. If as an employer, you have done everything in terms of pre-entry medical screening, workplace barriers, social distancing, making sure people are observing good hygiene and are wearing their facial coverings. And if you haven't had any instances of COVID positive cases in the workplace, or even if you've had any that were promptly addressed, then your response to Peter is, look, we have done everything that we can to make sure that we are preserving the well-being of our staff, and your participation is also necessary. You can't refuse.
Isn't there another variable there if you happen to be of a certain age or already immune or compromised immune health? Because I know the CDC has been saying from day one that, and I don't know what it looks like exactly in California, what accommodations need to be made if somebody physically has to be at work, but they also, are over a certain age group where they are more susceptible to contracting the disease, or already have autoimmune or any type of congestive type illnesses. I'm sure that impacts the decision there as well, correct?
Absolutely, Colin. So Peter is no longer in some age group between 20 and 40 years and in relatively good health. Now we are looking at an individual who is older than 65, who may have an underlying health condition. And at this point, you as an employer need to make a judgment call. If you absolutely positively have to have this person in the workplace, can you move them to a different position where they are in relative isolation from everybody else? And you know that they're not coming in contact with anyone who may be COVID-19 positive. And again, if that person can't continue somehow work remotely, you give them some kind of a task that can be accomplished from home, please do so. But what you will be liable for, if you know that you had an employee who is more likely to contract COVID-19, and you place them in an environment where there is a possibility of catching it, and then the possibility is increased because of greater degree of person-to-person interaction, that's where you become liable.
Thank you. So this one, can we continue to provide snacks and soda, et cetera, in office upon reopening?
Ideally, no. And morale is also something that we will be tangling with as we reopen. I've seen some of my clients actually offer to cater lunches just to raise the morale, just to welcome people back. What I advise against is having a communal coffee maker, is having a communal fridge, because people will be moving stuff in and out, and we hope they wash their hands. We hope they were observing good hygiene practices. Until we're absolutely positive of that, I would suggest encourage your staff to bring in their own meals that they can eat at their tables, because remember, in our break rooms, we want to ensure as few people as possible are taking place. So, but when it comes to just kind of putting snacks out for everyone, what you can do, and some of you may laugh, but actually distribute snacks individually to the desks, so people don't have to get up and approach the snack table all at the same time. But at the same time, they feel like, okay, you know, my employers, they care about me. They're trying to keep up my morale. They're passing out chocolates. So something to consider.
Thank you. So if a worker is in a cubicle, do they need to wear a mask? I'm assuming this depends on the height of the cubicle, but I'll let you answer that.
Absolutely. So there has been a bit of a grading with respect to how high the cubicle walls have to be. If you consider the average height of a person, and as they're sitting in the cubicle, now, let's imagine a cubicle that is 3 solid walls. We're not looking at a cubicle that is more of a shared desk where they are looking across at their neighbor, especially if they're facing one another. In that case, I would highly advise putting in the barrier that's at least 3 feet high from the tabletop. So with that in mind, let's consider heights of 55 to 60 inches off the ground, and that would be your cubicle wall. People are welcome to wear face covering in the cubicle, again, because there is usually, in your typical cubicle setting, a lot of traffic in between cubes, particularly if you have what are called dual cubes. Those are the ones where you have a commonly shared cubicle with 2 people, except they're sitting with their backs to one another, but there is no partition between them. Think about it. Even though they may be sitting at 6 feet apart, at a certain point, they'll have to get up and move back and forth. At this point, they may run into one another. And we definitely want to reduce the amount of time they spend coming closer and closer. So my advice is encourage people to wear face coverings, actually separate those dual cubes so people have empty cubes in between one another. And once you have built that distance, at least 6 feet, but the greater the better, people can at least move their facial coverings aside, catch a few breaths, regain their composure. But again, try to wear the face coverings for as long as possible, as long as they're comfortable.
Okay. Do you suggest businesses switch to disposable kitchenware, as in cups, plates, utilities, etc., or are reusable okay as long as they are washed properly? And are there laws about this?
So the law, and there is, and I'm noticing a lot of the theme coming back to that. The law is the general duty clause under OSHA. And that states, and I will repeat myself, employers have to recognize workplace hazards and reduce them. So let's say you have Peter, who is a very unhygienic individual, and Peter has tested positive for COVID-19. He goes into the cabinet where all the disposable cups are being stored, and he starts to fiddling between several cups, trying to find the one he likes. What just happened? He contaminated all the kitchenware. So there is no requirement for you not to do it, but I ask you to consider best practices. Honestly, if you want to provide disposable kitchenware, parse it out between the employees. Everybody gets 5 knives, 5 forks, 5 spoons, 5 cups. But again, think again, and it sounds a little silly, but now ask yourself, okay, where are people going to get water or coffee from? A communal coffee pot? A communal water cooler? This is where those controls may need to get wiped down after either every single use or several times a day. So at least for now, let's encourage people to bring in their own food, their own water, their own coffee, and keep it on their person so that they're not being shared and we keep it to ourselves.
Thank you. So just a couple more questions. If we temperature check, do we need to maintain the log? And I'm assuming the other part of that question would be, or do we only need to if somebody, is running a high temperature?
Wonderful question. So this is how you can avoid HIPAA violations. You do not keep a log. However, let's say you have 20 individuals who come to your facility and you temperature check them all. And for the sake of the argument, everybody scores under 104, which is considered to be a fever. You can have a list of individuals who entered the site. We don't know what their temperature is. We simply know that they have entered the premises and they passed the temperature check. That's it. At this point, HIPAA does not apply. Now, let's say you have somebody who came into the establishment and they tested 100.4 degrees or higher. Without recording their name, make sure that they are asked to step aside. They're provided with necessary information with respect to what they're expected to do next, and then sent home. But again, don't record their names. Don't keep actual lists of people, especially combined with their temperature readings.
Okay, thank you. So I understand you don't have to shut down the whole business if one person is infected and you can isolate the area. But this person has a bakery that is only 1,500 square feet. So as much as we'll try to keep our employees 6 feet apart, it's virtually impossible throughout the day for them not to interact in close quarters. So will we still be able to remain open if one employee contracts the virus?
It honestly depends on how quickly you caught it. If that individual was in the workplace for several days, closely interacting with the rest of the staff, you may have everybody in the workplace who has contracted it. Now, there is a caveat rule that was released for healthcare workers, because what we saw happen at the onset of the pandemic, a lot of healthcare workers were continuously meeting that test for whether or not they were in contact. And you simply couldn't have had multiple individuals go home and self-isolate. So that caveat said that as long as you're asymptomatic, you observe social distancing and you keep wearing your face covers on, because you're an essential employee, you have to keep working until you actually start feeling the symptoms, until you physically become ill. How will that apply to a bakery? If a bakery is considered to be an essential business, you can argue that same guidelines will apply. If you're not considered to be an essential business, you may have to consider closing your doors, especially if you found out a little too late.
Thank you. Well, that makes a lot of sense. So I'm going to make a statement. I think you can agree with it, Peter and Maria. The landscape is ever changing. There's more information gleaned every day as far as best practices, things that'll change. We will always try to share that with folks, but I think in reality, coming to experts such as you is a great idea. I always like to end our events with a call to action. So my call to action, everybody that's paying attention and listening in later, is to look at the email address here, maria.jacobo@insperity.com. And I believe Peter's is probably the same. So it's peter.zaretskiy@insperity.com. But reach out to either one of them if you have questions about anything that we've gone over or other questions that are more specific to your business. And if you've been impacted at all, which sounds somewhat comical to say because every business has been impacted by COVID-19 and everything else around it. But if you've been impacted by the pandemic and would like to find out a little bit more about what Insperity might be able to do to assist you in your business, I would highly encourage you to reach out to them. Again, I'd like to thank Maria and Peter for the time today and Insperity for finding the importance in providing this information to all of the businesses that are on here today. So with that, thank you all for your questions. This will be available online on our website, as well as we will send it out in an e-blast to those that are on the Chamber's database. It'll probably be in another day or two, but this information will be available. And I would, again, encourage you to connect with Maria or Peter, with the folks at Insperity, to get you taken care of. So with that, thank you, Peter. Thank you, Maria. And,
Thank you, Peter.
and you
Thank
all,
you, Maria. Thank you, Colin.
and you guys have a great rest of your day. Thank you.
Take care.